Welcome everyone to our special celebratory Healthcare Decisions Month. We had Healthcare Decisions Day. We are all about healthcare decisions. It is April, and I'm so excited you all could join us. I know some of our good friends and colleagues reached out, are not able to join us today. We'll miss our communications, advocacy, and education leaders, Steve Hahn and Connie Bonebreak and Mike Kondratik all had other events today. And Mary's traveling today, I think, Mary Bethel. But I am so excited to see all of you. We have been actually planning this special April edition for a long time now. Excited to have both of our speakers, both for Friday Facts and our main speaker for the meeting, all be about healthcare decisions. And I don't want to take too much time opening, just as some of you are starting to do. Go ahead and put your name and where you're from in the chat line. And I am starting off with both excitement and apologies. I have been so impressed with I don't know how, I always say trifecta, but it's a quadrupefecta. Anyway, the four phenomenal women that make up Novant Health of your advanced care planning team. And I've had a lovely experience working with them, especially on the advanced care planning and clinical practice work group. And so I've heard some great updates, but we realize they have not been highlighted for Friday Facts. Oh my goodness. So Sangita and I were talking, we need to right that wrong, and couldn't have been a better month to do that than for our advanced care planning, healthcare decisions month celebration in April. And so with no further ado, I am going to turn it over to Sangita, who's going to be leading the update and sharing all about the Novant's advanced care planning team. And I will say, if you don't follow Sangita or Crystal or Jennifer or Angela on LinkedIn, you need to. There's so much. I know that there's so many wonderful things going on. Sangita's great about posting and the other teammates. And so they are out in the community. I see it all the time. I'm constantly clicking likes and loves, because they really are out there. And I'm so excited for you all and myself to learn more about their efforts. So welcome, Sangita. And you can introduce the rest of the team, though I see their beautiful purple backgrounds.
Thank you, Heather, this for the wonderful, beautiful introduction and your support and always encouragement for our post and all that we do. Thank you to every one of you. So I am Sangita Ramani. I'm the manager for advanced care planning at Novant Health. We are the Choices and Champions team. Very good morning to all of you. I'm joined here today by three awesome, amazing teammates, subject matter experts who I have learned a lot from. They've taught me a lot, everything with their background, with their expertise and skills. They know it more than I do. So I'm representing everyone, and this is their knowledge and what all that we do, and I'm sharing with you. So again, a very good morning to you. Let me start sharing my screen and you guys tell me. Okay, this is the screen I want to share. Okay.
Oh, it's starting. Let's see.
Okay, can you guys see my screen? Not yet.
No, it started to share and then it stopped, but it was starting.
Okay, let me see. This is the screen and presentation share.
There we go.
Okay, and now I want to make sure this is in the right mode to share once.
Slideshow, great.
Okay, so tell me which, hold on. Is this the right screen that you're seeing? Is this the presentation view?
No.
Yes, you can just put it to slideshow so it'll go a little bit bigger.
Slide.
All the way at the top. You can do it that way. Oh yeah, you could do it that way too. Look at all these great ways you could do it. That little button right there.
But I always, sometimes it works.
Oh.
Yeah. Slideshow, hold on.
Or on the control right there. Yeah, there you go.
Okay, I pressed this one. Is it showing it for you guys?
Click from the beginning.
To the left. Oh, from the beginning?
Yeah.
Okay.
Oh.
I did that.
Huh.
Maybe
Maybe do. share
Mm,
your other,
okay.
yeah,
Let me share my other screen because on other screen I do see, sorry about the technical challenges.
Oh, always. As they say, power corrupts and PowerPoint corrupts more.
Okay, let me share. Okay, I want to share the other, stop sharing. And let me do this again, fingers crossed. So share. Okay, I want to share this screen now. Okay, screen two, share. And I will now,
Oh,
can
hey,
you
there you go.
can you see our screen?
yeah,
Yes, we
that's right.
can.
Okay, wonderful. Thank you for your patience.
Perfect.
Alrighty, so again, good morning to all of you and happy National Healthcare Decisions Day month. So as you know, this month is a powerful reminder for the importance of planning ahead, because making your healthcare choices known is one of the most meaningful gifts that you can give to your loved ones and to your care team. Again, thank you all for all the work that you all do, each of you do in supporting advanced care planning and much more beyond that for our communities. So let me start by sharing with you what our advanced care planning team works and does at Novant Health, what we currently do, and some of what we have done in the past few years. So let me start by the screen shows our Choices and Champions team at Novant Health, our advanced care planning team. We advocate and create awareness on advanced care planning by providing education and resources to everyone within the Novant community and external to the Novant community. Now, as you can see, we are a very small team. As I would like to say, we are a small and mighty team given the size of Novant. Novant has what, 40,000 plus team members now, not just North Carolina. We are expanding into South Carolina as well. So, given that size, we are a very small corporate team. Our team is led by Adam Coons, who is our Senior Director of Advanced Care Planning, Spiritual Care, and Clinical Ethics. And I lead the Choices and Champions team as the manager for advanced care planning. Our team also includes two team members or two advanced care planning facilitators, one for the Charlotte region and another for the Triad region. So primarily we covered Charlotte, Triad, and the Triad or the Winston-Salem and the coastal region since last year. So apart from the two advanced care planning facilitators, we also have three amazing regional coordinators who are on a part of this coalition, Crystal, Angela, and Jennifer. Now, Crystal is for the Triad region, Angela covers the Charlotte region, and Jennifer for the coastal region. Lastly, we also have a project manager who does data analysis and reporting, dashboards, everything that our team does, putting it together so that we can share it with our internal partners, external partners, and show everyone the work that we do and the impact that we create. So that is our team. I will move on to the next screen. Let me see. Yes, okay. So this slide, this is on a high level, just to give you an idea what our team does in supporting our internal and external partners. Our regional coordinators provide education and advanced care planning support to our patients, family members, team members, and also our community. As you know, community at large. They do a lot of community events as well, a lot of education within and outside of Novant. And just as an FYI to share with all of you, all our resources and services are free of cost to everyone within and outside of Novant. Uh, our advanced care planning facilitators, on the other hand, they also provide advanced care planning support and education, but primarily to our internal partners and more on the ambulatory side. And we all support and back up each other whenever needed. So on the right-hand side, what you can see is what our ACP support looks like, what we do, what our work look and comprises of. So advanced care planning education is the cornerstone of what we do, what our team does. Our goal is to provide patient-centric care to bring ACP services to all our patient and communities. And we have done this by bringing advanced care planning services to our patients in the ambulatory setting. We educate in both acute and ambulatory. Why? We call it a transformative approach because we are reaching out to the patients in the ambulatory setting, that is, moving this process upstream when the patients are healthy, when the patients are in their sound mind, to be able to have these goals of care conversations, to have these discussions before they actually reach a point in their lives when they have a serious illness, or before life takes over, the journey, they're close to the end of life. So that's where we are trying to connect, make these connections with patients and have these discussions. Our vision is to empower all these individuals, patients, and the communities to have their healthcare choices and wishes known so that these can be shared and honored when one is unable to speak for oneself. Our goal is patient empowerment and emphasizing the importance of having these conversations. And we call these goals of care conversations. And in doing so, and as appropriate, depending on the patient's uh, health, depending on the family situation, we also encourage them to complete advanced directives, which is the healthcare power of attorney and living will. We also assist in explaining these documents, completing these documents, and also help notarize the advanced care planning documents. This process also entails what we do, also documenting goals of care conversations in an ACP note or an advanced care planning note, which is shared with our entire organization. It can be accessed by anyone within Novant Health, especially for our providers, which can see these notes, and these serve as a roadmap for the healthcare team, the patient's healthcare team, in guiding these providers what needs to be done in case a patient is ever unable to speak for themselves. And then depending on the patient's health status, we may also suggest patient and or their providers to complete the medical orders, which is the most, or the DNR forms. So this is on a high level what we do within Novant and external to Novant. Okay, any questions for me at this point? Sorry, I can't see the chat, or if anybody is, raising hands, if you can let me know. Any questions for me at this time?
So
So,
far,
Sangita, I had a question. Oh, somebody was before me. I'll let them go first.
oh no, it was just me saying so far you're seeing affirmations, but no, go forth, Marcet.
Yeah, Sangita, I was, and you may be going to come to this a little bit later. On your team, is there any collaboration, I guess, with chaplains or other social workers?
Oh,
I know you're focused on the ambulatory care piece, but is there any sort of integration with that piece to have them help you reach everybody?
absolutely, Marissa. That's a great question. We partner very closely with our chaplains, which are spiritual care team, because we get number of requests from patients, team members, providers. Now, these can be in the acute setting, these can be in the ambulatory setting. And we do a lot of education for our spiritual care team, not just partnering with patients, advanced directives, or the patient requests, but also doing education with our chaplains, because we want to be on the same page with respect to any advanced care planning support, the documents, documentation process, notarization process. So yes, we partner very closely with them from any questions they might have, any question related to education. They reach out to us with questions, hey, this patient has a question, advanced directive notarizations. And Angela, Crystal, and Jennifer, they partner very closely with them. Also, if the social workers, they have questions from patients, or they have their own question regarding advanced directives or anything to do with, conflicts that's arising in the acute setting, if the patient is an inpatient or family setting. So yes, we partner very closely with spiritual care team, with clinical ethics team, and also any other team members who could be social workers with any conflicts, education. So yes, we collaborate and partner together and work together as a big team in making sure that each of us are on the same page. We are talking the same language, we are giving out the same message to the patient or anyone in need.
hmm
Yes.
And your team members are chiming in. Crystal, oh, good. All three of them just chimed in. Crystal shared, we also partner with faith groups in the community and work with our social workers and community health workers in the community space to assist community members. And I see a lot of those pictures. Jennifer shared, we partner with our internal teams as well as external organizations such as senior centers, health fairs, churches. That's also the pictures I get to see on LinkedIn. And Angela shared, we also partner with hospice and palliative care. So lots of partners. I had a question also. Do you use any one of I know there are a number of the vital talks and respecting choices and serious illness conversations from Ariadne Labs. Are there are there these external um, formats or pathways? I can't find the words. The those kind of scripts, for lack of a better. Do you use that to help with your conversations? If people know what I'm talking about, those serious illness different packages that are available. Or do you do your own?
Primarily, we do our own, and correct me, Angela, Crystal, Jennifer, if you have any information, because while working with the community or patients, I have seen we gather information for our training from all these resources. But I think what we share, in case there are resources that the patient needs, we do direct them to other avenues, or respecting choices, conversation project, five wishes, in case they need another language. We do avail these resources and share these resources and other resources as well. I'll
Great.
let any of my other team members chime in if from their experience what they have shared. Yeah.
Hmm. And feel free to unmute because I know Angela shared that you do use the Serious Illness Guide by Ariadne Labs.
Okay.
There's our nice, and Crystal offered a combination of different resources. The serious illness work by Ariadne Labs is open source. There's not a cost like how Vital Talks is proprietary. So just like we use serious illness support from Ariadne Labs as well. That's really helpful.
Great. Okay.
Yeah, one of the things I'll share that I just learned, I guess it was this week, that Vital Talk is getting ready to do something, putting together a tool that is more cost effective for community and rural areas. And they're also putting together something for surgeons. So more to come on that, but I did hear that this week in one of the groups that I have a chance to sit in on. So
Wonderful. Thank you, Marisol. Yeah.
Yeah, and
Anything?
I see that Jennifer added that our friends from Lower Cape Fear Life Care, Heather and Jason are both active with our with our work groups and with the coalition. It's good to know they have the Begin the Conversation booklet. It's already making me think, and we'll talk more when we do an update on our Advanced Care Planning Educators Collaborative. And we have all these interns. I'm thinking it might be nice to collect all the different workbooks and different brochures and things like that that folks use to see where we see a lot of consistency and where there might be some differences. So that's actually really helpful to know who has packaged materials and who has their own. Anyway, super helpful.
Thank you. Thank you. Anything else before I move on to the next slide? All right, I'll take that as a no. So let me transition here. Okay, so now this slide, it's focusing on the program that is called Identifying Best Practices for Advanced Care Planning for Ambulatory Clinic Settings. This was a program which was funded by the Duke Endowment. Before I go into the details of the program, I would like to share some background information. So in 2020, our Choices and Champions team was the recipient of the Circle of Life Award from the American Hospital Association for our transformative approach to knowing and honoring patient wishes throughout their healthcare journey. Following that, in 2021, our Novant Health Forsyth Medical Center was awarded a grant by the Duke Endowment or the Foundation to support the progression of the Advanced Care Planning Program. Hence, this program was to proactively offer goals of care conversation and provide advanced care planning education resources to patients to assist with advanced care planning discussions with their families and those who are important to them and with the patient's healthcare team. So this program ran for 3 years, 2021 to 2023. And during this program, what we did is we partnered with 10 ambulatory clinics. 9 of these were primary care clinics, and one was a specialty clinic. And through our transformative approach, that is moving these advanced care planning discussions upstream in the ambulatory settings, we reached out and connected with these patients of from these clinics by sharing our advanced care planning education, by sharing our resources with them, and asking them whether they would be interested in having a conversation, advanced care planning conversations, or even if they had their documents in place, if they had any questions, and also sharing with them the next steps of making sure that we are closing the loop if they have, like, for example, advanced care directive already done and in place, making sure that they know that to share this and to upload these in their charts. Otherwise, their healthcare team, their providers will not be aware of that. So some of these questions, answering these questions in case the patient had interest, or answering any of the advanced care planning questions. And when we did an outreach to these patients, some of these patients agreed to our services, and I would say some declined, and some had already had their documents in place. Whereas some just wanted us to send information to them, and our toolkits, which we have put together quite a few resources, which I'll share with you. So, our main focus was to have more of these conversations, moving them to upstream, meeting with these patients in the ambulatory settings when they're coming to meet with their providers, and also to educate them, not just the patients, but also working very closely with these clinic team members, with these providers, to educate them to how to initiate these conversations, how to weave these conversations in during the visit with the patients, and also help these providers with billing and documentation. So just as a very high level synopsis of this is what we did during, connecting with the patients, connecting with team members, also connecting with the providers, making sure that in case patient shares that they had a conversation with our team and the patients ask the providers, I want to do a most form, or what is this about, making sure that the providers are also equipped, they know how to carry this forward, they know how to enter this information in the patient's chart, how to document this, and how to build this. So it was a very close partnership with all these clinical team members, patients, and their families. So some of the expected outcomes, what we expected from this project or from this program, that to share our information, our toolkits with the patients who wanted to consented to our services, and some of the documents and the toolkit that we put together, which included, for example, the North Carolina hierarchy of decision making. Some of the collateral that we have put together is, why is it important to select a healthcare agent? Who is the best person to be a healthcare agent? What conversations need to happen with a healthcare agent? What are the roles and responsibilities? What are the next steps, and so forth? So we mailed them the whole toolkit to let them know who we are, what we do. So even if they don't agree, 6 months down the line, we are receiving referrals today from those patients' providers. Hey, now I'm interested, because it might not be an immediate consent that we are getting, but we are seeing the impacts, what we have done 2021 to 2023 still keep going. We keep getting referrals from those clinical administrators, team members, and providers as well. And some of the other expected outcomes, again, to have more of these goals of care conversations with patients and families, resulting in discussions between providers and patients. We also expected to document patients' healthcare wishes, whether it's maybe in an ACP note or maybe in a questionnaire form in their chart. Again, we also expected to complete advanced care planning documents and other advanced care planning forms for the patient. We were also expected to provide these services to underserved populations, especially focusing on the underserved population because, as we all know, there is a huge need for these services in this community. And last but not the least, also comparing these costs of patients through the healthcare journey. And we expected to see the patients who consented to our services versus the one who declined, expected to see that the ones who consented to our services having lower costs. This is what we call the cost avoidance. Other expected outcomes were less number of admission days, less ED visits, shorter length of stays for the patient who availed our services, and also completing medical orders, which is the most, and the DNR forms as appropriate and necessary. So we had all this expectation from the program, and we observed that the actual expectations were quite encouraging for us. We saw that we were successful in bringing these services to the patients, and 90% of our patient population was in the underserved category. So we were really pleased to see some of the um, outcomes, and there was a huge increase in the number of advanced care planning documents on the patient's chart, like the advanced care planning notes, advanced directives, most DNR forms, not just from our team, but also having a ripple effect, the other team members putting in these advanced care planning documents being added to the patient's chart. And we were also successful in moving the needle on the comfort level. I would say this was a huge accomplishment on the comfort level of having these discussions, having these conversations between the patients and their family members. We used to meet with patients, they used to always have a family member with them. So there was an increased comfort level, not just with patients' family members, but also with providers and team members, providers getting to know how to initiate these, how to document and bill for these. So this was a huge success for us. We received multiple accolades and testimonials from patients. Again, everybody within our team, providers, team members, patients, and their families, as to how our outreach and services have helped them and their families. And last but not the least, we also noticed there was a huge cost avoidance when comparing to the patients who consented and availed our services versus the one who declined. We saw less number of admission days, less ED visits, lower length of stay days, and for the patients who availed our services. So just in conclusion, this program was success. We learned a lot, things that work well, things that do not work well. But in short, it helped our patients feel informed and empowered to have these important discussions. And we continue these conversations today, working together with many more patients, many more clinics, because from our lessons learned, again, as I said, what works well, what doesn't work well, what are the challenges these teams face, what are the challenges the patient face. So we ourselves are better equipped, not just our patients and team members, we ourselves know what we need to do, where we need to focus our energy as we continue to onboard new clinics. So this is the impact in various ways that we see receiving, for example, continue to receive referrals from our providers, team members, advanced care planning documents being completed, we getting multiple requests from patient team members, from the teams that we have partnered with. And we continue to partner and onboard many clinics currently. So this is what I have for you today. And
Well,
on a high level. And again, thank you for listening in for this opportunity. And I'll take more questions on
okay,
what I shared. Yes,
good, because we have more questions for you.
absolutely. Bring them on.
Um, as some of you know, I'm a few hours behind, but this is just really waking me up. I'm super excited. So those outcomes are really impressive. And I love that because your work is part of Novant Health and you have the entire health system connected, you can look at these outcomes that are further downstream or upstream. I'm not sure which part of the stream, but that you're looking at the impact on healthcare utilization and cost avoidance and admissions. I selfishly and curiously, what of that is publicly available? Like, is there a report? Because I know for me, who does education just in the community, I'm not able to see the impact in healthcare utilization or in, putting things into the health chart. Are some of those like, could I see some of those reports? Is some of that shared publicly so we can share with others about the impact?
Yeah. That's a good question, Heather. I was actually thinking while putting together this information, what we can share, what's internal, external, definitely, especially given the data and how, it is. So I would like, I can, because I know we have concrete numbers, but I wasn't sure what data we can share with the external partners. So I can definitely go back and look and maybe share what percentage, of the cost savings we have, things like on a broader perspective that we can share with you rather than the actual numbers, but what percentage of data, cost avoidance data, number of length of stays, and things like that. I'll make a note of that. Yeah.
Thank you. I know I would appreciate that and others, and I think it just really helps. And I'm excited. We'll be talking with Lisa soon with those Secretary of State's office, those of us that are just on one part of it, but knowing how the impact throughout the health system and really how it impacts the individual patient's journey. So helpful. There are a few other questions. I know you can't see the chat as easily when you're sharing slides. I know I go through that. Vicky asked, are you using Epic? And I too would love to see the reports you were able to pull from the system. And Vicky also, is from our ECU trifecta of fabulousness. So those of you that are embedded within health systems, really encouraging. And so to see your kinds of outcomes will, I think, help to inspire others. So are you using Epic?
Yes, yes. Thank you for the question. Yes, we use Epic, and I know Epic template format, the view, it's different versions for different healthcare system, what you see and how you customize, personalize. But yes, we do use Epic at Novant Health.
Great.
This is Vicky. Do you think we could connect with Wendy and see exactly with Rhonda and see what reports she pulls? Because that's where we're having issues, is trying to get the reports.
Yes, Vicky, I would say our project manager is is the one who is the expert at pulling data reporting, putting the dashboards together. So I might not be the expert, but definitely I can connect with you and kind of see what reports we are pulling that helps us gather that data, because our project manager, she's an expert at numbers, at Excel, pulling reports, putting these charts and dashboards together. So
Yeah.
yes.
That is not my expertise, but thank you very much.
Same here. Yes.
And I love that. And I love the idea of use each other in a lovely sort of we won't use, we'll say peer support as opposed to peer competitiveness, but whatever we can do to work together, and those of you at different health systems to sort of, hey, this is being collected and shared at this health system. Are we also collecting the same dashboards? So how we can use each other and encourage each other, I think, is a wonderful role that we can play with the Serious Illness Coalition and with our ACP Educators Collaborative. So that way there can be more gathering and sharing of data, right? If you value it, you measure it, and then you share it. Uh, Marisette asked a question. What was the driving force for Novant putting together your ACP team for your system?
All right. I might need my team too, because they have been longer on this team to put together this team. This team came, Adam was actually, this was 2013 or 2014 when Adam was on the team and trying to pull together. Angela and Crystal have been on this team. I would, ask them or request them to chime in. What made us, come together and pull this initiative, Choices and Champions team
Um,
together?
yes, it was the brainchild of our former senior director, Melissa. And she and our CEO at the time, Carl Amato, spoke and really saw a need to have these conversations, and the need to have these documents in the chart. So they came up and developed. So Carl gave Melissa carte blanche to do what she needed to do, and there comes Choices and Champions. We, as you know, Deb Love was on this team. So even though she is no longer with us, and Melissa's no longer with us either, she and Melissa really were a driving force, and Adam, of course, to progress choices and champions. The goal was to always know who the patient trusted to speak for them in case they were unable to speak for themselves. So there were some initial goals around choosing a champion, a healthcare champion, which is unique to Novant Health. If we can get to that first step, that's the getting your foot in the door and hopefully onto other conversations. So we had a 3-year goal around healthcare champions, which we were able to successfully meet. And then, things shifted, COVID happened. And so then here comes our team, fresh and new. And we decided to, continue on with choices and champions and see if we can't push the needle further. Instead of our foot, we're trying to get our whole leg in the door and getting these conversations had. And another thing that came out of the Circle of Life award with the meeting with all the folks that were part of naming us as one of the recipients was that we needed data. So I think the Duke Endowment helped us really kind of focus on making sure that we had ways to track data. So that's kind of how we have kind of evolved over the last 10 years or so.
Well, I'm just thrilled to hear about the journey because most health systems haven't formalized around this piece. And so, a lot of times they're working on individual, which is needed with the healthcare provider. And of course, we know that, but there, our folks in terms of Vicky and their team, what they're doing with their health system, but a lot of places have not sort of put the resources into creating this kind of a department. And even though there's greater need, but to have a core nucleus of people that are working on this is really key. I think the other piece is that we legitimize the work when we do collect the data. And so the data is so critical. And even more so, I think, in the future, when we talk about community impact, we have to really help our community members understand how that data also helps and how we can continue to get philanthropic support because we have the data. And with the data, you can tell the story. So I'm just really impressed with what you guys have been able to do in the work that you've got going on. Of course, Epic is all over the country, and everybody in the regions, they have little tweaks and things that they need some help with, but at least there's a connected system where people could look for advanced directives, if they travel across state lines and those kinds of things. But I had not heard about the early years of the journey, and so I was just curious. And we know everything starts with senior leadership, with culture, and then it drills down. So thank you so much for that.
And I did add, you'll see yes to data helping for not just system support, but also the philanthropic support, but for legislative support. I know I'm going to turn to Lee in a while after later on in the meeting about what's going on legislatively. I'm getting more and more active with what's happening with our General Assembly and going to talk with them in 2 weeks. And so having data to say why we want to reduce administrative burden and how we are actually seeing impacts when you help people make it easier for them to make their wishes and preferences known, it also has this impact down the line with their healthcare utilization. So win-win. Thank you, Vicky. Yes. Oh, you're good about raising hands. You know me, I'm just like, pop, 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 pop.
I just was trying to be good. I just want to know, when y'all save the advanced directive to the electronic health record, does it share it in the MyChart setting, or have y'all been able to do that without it releasing?
That's a great. We actually have recently been talking about this more because we get this question in the community a lot. So if we, as of right now, the way we understand it, and this is a question we're also taking back to our team, if our team in Novant adds the patient's advanced directed to the chart, it does not show up in my chart that we know of.
Okay. We're working on that as well, so maybe we can kind of join forces. We've requested that Epic put in a some kind of whatever they do to fix it. So it won't be, yeah.
Adds it themselves through their own my chart, they will be able to see it, and it also goes into their record. So a lot of
Okay.
times we'll inform patients of that. If you want to see this, so say if you're traveling to another state, you'll have easy access to the document, a copy of it at least.
We've got to where they can upload it. Just this week, that was our National Healthcare Decisions big push. But yes, they can upload their documents, but they can't see the ones that are already saved in the charts because of some issues there. Okay, I was just wondering. Thank you.
Yeah, and we did speak to someone who used to work for Epic, and they said there's a button that like
There's always a button.
Yeah, there's just a button. I'm like, if it's that simple, we just need to get the button pressed.
Well, our concern is that if we press that button, there's going to be a lot of bad data that's released.
Absolutely. There's always good with the bad, isn't there?
Yeah. Okay. I'll hush. Thank you, though.
Hey, no hushing needed. This is our time to not hush. This is our time to share and celebrate and learn. And yes, for those of you who see, I'm typing things in the chat because I couldn't find any paper and pen in my in-laws' basement. And so certain things I want to remember because I want to be able to share both with folks outside of the group that we're talking, including to our funders. So any other questions? This is so helpful.
And Heather, I'll share this presentation with you in case you want to, share it with the group.
Yes, thank you so much. Well, this has been great. Thank you so much to Sangita. And in the background, it's like I'm thinking, what is it? The Supremes, you've got Sangita out there singing, and then you've got the chorus of, women singing behind them with Angela and Crystal and Jennifer. But you all are very, you inspire me all the time, seriously, not just because we're in a lot of meetings, but because I do stalk you on LinkedIn and because I'm doing community work and a number of us. Betsy Barton, I see you, and you are all over LinkedIn too and sharing what you're doing. And so it's, and Anna, I saw you at a meeting, like everyone's out there doing cool things. And the more that we can share it with each other, either in these meetings or on LinkedIn, that's the only social media platform I'm really on. It lets us know we're doing the right thing. So thank you. Any other last questions for the Novant quadrifecta? Okay, making up.